team had decided that we were not going to end up in that situation. Smartsourcing was an alternative that allowed us to leverage the strengths and core competencies of partners in a unique and novel way. It was as though someone had just turned the lights on. We immediately began to look at the hospital through a very different lens, identifying opportunities and partners with deep core competencies that we would want to smart source with. While most partners we spoke with were still stuck in the world of outsourcing, we noticed that a few had already started to think about smart sourcing. The conversations that resulted with those progressive companies were a world removed from the concept of outsourcing, which basically distances the sourcing partner from the organization it's serving. These were relationships that were guided by common purpose. We quickly realized that there was significant additional value in partnering in a much more ambitious way than we had initially expected. This was not about the math of zero sum. It was a classic case of 1 + 1 = 3. This is the fundamental value that smart sourcing drives with the right partners. They are not just focused on their small part of the value chain. They are looking at the whole organization, raising their hand and saying, "Have you thought of this idea or that concept?" It significantly changes the way the organization functions in a very positive way that opens the door to innovation that would simply not have been possible otherwise. Reimagining healthcare builds on many of the ideas in smart sourcing, but it goes well beyond them to provide not only a vision, but a roadmap of how we can re-engineer healthcare to refocus it on what matters most, the patient, while at the same time reducing the crippling administrative friction that drives up costs and undermines quality care. In the process, we may well be able to transform American healthcare into a much more sustainable model than what we have today. The current U.S. healthcare model cannot continue to function in its current state. What's lacking is a practical strategy that guides healthcare into the future. I've lived in the healthcare industry long enough to know that won't be easy. The transition to a more sustainable model will not be a simple or painless process. So much of today's healthcare industry lives off the friction that's been baked into the system. But the solution is there, hidden in plain sight, as Tom says. If we have the courage to follow some of the suggestions in this book, we may finally be able to put healthcare on a trajectory towards affordable value and quality care for our communities, our patients, and ourselves. Creating a sustainable healthcare system is the most important journey that the U.S. and the world will be faced with for a generation, and now we have a logical way to approach the transformation that must occur to make that journey. Most importantly, reimagining healthcare offers a reason to be hopeful about the future of healthcare and the significant positive change that it can bring. But it will take healthcare leaders willing to step out of the traditional industrial age model of healthcare to embrace new ways of thinking about the role of the hospital and a new generation of organizations, what Tom calls HSPs, that can take on the critical role of innovating all of the non-clinical activities that today make up over 30% of healthcare spending. Reimagining healthcare is a clear and straightforward guide to assist in that process. As I look back to that original meeting, when I first learned about smart sourcing, I realize how fortunate we were to have someone at the table make the suggestion that we evaluate a new way of looking at healthcare. Every healthcare provider now has that same opportunity. And if we take it as an industry, I have no doubt that the result will be a remarkable future for healthcare. John Russell, Senior Vice President and Chief Information Officer, Multicare Health System. Introduction. The Blue Pill or the Red Pill. There is an iconic scene at the start of the Hollywood blockbuster movie The Matrix, in which Morpheus asks the central character, Neo, in reference to The Matrix, "Do you want to know what it is? It is the world that has been pulled over your eyes to blind you from the truth." Neo sits motionless as Morpheus reveals a blue pill in his left hand and a red pill in his right. You take the blue pill.